Establishing goals.
We have decided that HIV/AIDS will be our priority. But what do we want to do about it? Our general aspiration, our goal, is to prevent the devastating tragedy of a full-blown AIDS epidemic.
But in order to design an effective plan, it's necessary to take a careful look at where we are now and where we want to be in the future.
In 1996, most of the people in our country infected with HIV or AIDS were intravenous drug users. Less than 1% of sex workers were HIV positive. But recent evidence shows a rapid increase of infections among the prostitutes in our southern provinces, where there is a large commercial sex industry. The experiences of other countries have shown that HIV/AIDS can spread rapidly once it takes hold among sex workers, especially those who work along major transportation routes. Truck drivers and other men who leave home in search of work contract HIV from sex workers. They may spread it to other sex workers. Then, when they return home, they infect their wives. We want to contain the spread of HIV/AIDS among commercial sex workers. 3 years from now, we want the rate of HIV infection among sex workers to be less than 5%. If we can accomplish that, we will have saved thousands of lives. Thousands of children will still have their parents. The decision to do something is not difficult to make. We have come a long way from our first meeting. Then, we all had different ideas about what should be done. Now, we are all committed to addressing HIV/AIDS. We agree that it's practical and we've set a specific objective to contain the HIV infection rate among sex workers to 5% 3 years from now. Our group still needs to decide how we will accomplish our goal. That will not be easy, but we're ready now to move ahead. And yet, what about the family who came into the clinic? Will our efforts help them?
Anytime we succeed in making good decisions for change, we help, if not that family, others who will come after them. We use the tools we have to keep on trying. In Module 2, Finding Solutions, we will explore further the development of outcome objectives and the planning of an intervention strategy.